This is our report of findings on Pushpak's case number 626. I'll review this quickly so you get a sense of how well the irrigation device performed and how you can refine your image interpretation. This is Pushpak's PA, and this is the CBCT he submitted with the case. There is a suggestion of an apical rarefication. His diagnosis form makes note of the occlusal trauma, night guard use, possible crown or root fracture, and a thickened PDL. There is an opposing tooth and occlusion on the tooth. He also notes some distal lateral bone loss and also gingivitis around the tooth. The pulpal and periapical diagnosis was necrotic pulp and acute apical periodontitis. The treatment prognosis was given as guarded. The treatment note outlines the discussion with the patient and an offer to extract the tooth after a gentle wave procedure was done if it was determined the prognosis was poor. 3 weeks later, the patient was seen for treatment, the case minimally debrided, and a gentle wave procedure completed without incident. At that time, Dr. Pushpak believed he saw a fracture running across the pulpal floor, and it was decided to extract the tooth. The tooth was extracted the same day, placed in formalin, and sent to me. These are my radiographs, and this is how I received the tooth. There was a single apical foramen and a stepped minimal access. The crown was sectioned, but no pulpal floor fracture was detected. As mentioned in the initial report, in the last tutorial, the common terminus presented problems in sectioning, and it was decided to section a central segment and image both sides of that segment. This is the mesial side of that segment, and this is the distal side of the same segment. Now I'm going to do an experiment and show these sections using the TDO image organizer because it makes it much easier to display many images, especially where you want to zoom in. In the TDO image organizer, the scroll button on the mouse enables zooming, and for those who use TDO, that is how I suggest you review these images. It saves a lot of time. If you don't have TDO, you have my sympathies. We're going to look at multiple sections from the coronal, mid-root, and apical areas on both the mesial and distal sides of the root. Let's look at the mesial root, area 20 of the coronal section. As you can see, the pulpal space has been very well debrided with no pulpal remnants evident. The dentinal tubules appear open with some pre-dentin debris. As you zoom in, it looks like much of the predentin has been demineralized, as well as significant demineralization of the dentin at the mineralization front. The peritubular dentin has also been completely demineralized and is not visible. Looking in the midroot area, 18 and 19 shows clear evidence of the instrumentation, but almost none of the instrumentation debris that one typically sees. In the area number 18, there is very little predentin evident, and the tubules are wide open and significantly demineralized. Again, I see no evidence of any peritubular dentin. There are a few scattered chalcospheroids of predentin and also evidence of some demineralization at the mineralized front. In area 19, you see some minor smear layer from instrumentation, but most of the canal is free of any pulpal debris or even instrumentation debris. Again, the tubules are incredibly clean, and the peritubular dentin has apparently all been demineralized. In the apical area of the mesial root, we're going to zoom into areas 16 and 17. In area 17, it's the same story with minimal predentin present and significant demineralization at the mineralized front. In certain areas, you should by now be able to detect where the predentin substructure is and how it is being removed in layers by the action of the irrigants. A high mag view of how you can detect the difference between predentin mineralization and fully mineralized dentin. In area 21, a little further apically, you can see some evidence of instrumentation, but again, no pulpal tissue at all and only predentin debris. You can see the well-mineralized dentin is being partially mineralized, even this deep into the canal. You get a sense of the hydroxyapatite crystals here on the collagen as demineralization has started on the collagen substructure. Now on the distal root, there's multiple areas we will examine. In area 11, an area not touched by any instrument, I believe, you get a very good sense of the demineralization of the dentin proper, and it is quite significant. In area 12, where there is evidence of instrumentation, you see more predentin debris and less demineralization of the mantle dentin. These large rocks are incompletely demineralized predentin, with their chalcospheroids clearly evident. This is right at the predentin mineralization front border. Now, area 13 is in between where the instruments contacted the root, so its appearance is similar to the other uninstrumented areas. The predentin is almost completely removed, and the underlying mineralization front significantly demineralized. High-resolution pictures of this process should give you a very good sense about how sequential demineralization occurs with gentle wave. The dentin appears to be removed in layers. Again, the sequential removal of the chalcospheroids taking place. Now, area 14, you can see instrumentation smear layer, but even here, the smear is almost non-existent, and the tubules are in the process of being demineralized. Here you can see the collagen substructure of the dentin, and again, no peritubular dentin. The nucleating crystals of the hydroxyapatite are clearly visible here. Area 15 is pretty much the same thing as the other uninstrumented areas, a remarkably uniform picture. Now in midroot areas, we're looking at 5 areas, 7, 8, 9, 10, and 22. I'm going to fast forward through these areas because they are almost completely identical to the previous areas. If you wish, you can run the video at 1/4 speed as you go through these if you desire the image training. Now in the apical section of the distal root, the area which historically has shown incomplete debridement problems in MIE cases, the picture is not very different from the more coronal areas. Again, I'll fast forward through these because the picture doesn't change much. In area 6, where it appears there is some instrument smear layer, a closer examination shows no smear layer, no pulpal contents, and very little predentin debris. Just incredibly clean. There is one area at area 3 I would like to review in normal time. When you look at this area near the accessory canal, you see quite a bit of predentin debris, but on the mineralization front, you see what looks like a bacterial biofilm, and it's important for all future cases that you appreciate that this is just normal decalcification of the primary dentin. And these are bacterial morphotypes, but they are not bacteria. They are just the nucleation clusters being demineralized. Here's another example where the degradation, demineralization of the chalcospherites masquerades as a biofilm. If you look at the decalcification, demineralization going on here, there are what appear to be bacterial morphotypes here, but it's just the demineralization process going on of the dentin, and they are not bacterial morphotypes. The next video will review more of the science behind these inferences and how a more complete knowledge of collagen biochemistry and mineralization theory can help you with your image interpretation.